Sir, we are live now. With all your permission, I'm starting this session. Good evening, everyone present here. I am Faraz from IGCP. Welcome all the participants on today's session. Let's welcome today's speaker with great honor, none other than Dr. K. Suresh, sir. And today, sir is going to speak on a topic management of headache in smaller setting. And let me share some of the achievement of sir. Sir has done MD, DIH, DF, FIAAP, FIPHA, FISCD, family physician, public health consultant at Bangalore. By taking not much time, I would like to invite sir and hand over this session to sir. Over to you, sir. Kindly proceed from here.
Thank you, Faraz. Dear friends, we are talking today on one of the commonest conditions, probably even least consulted for, is various types of headaches. My today's presentation takes you through a few steps, namely, first, how do you assess if a person comes to you with a complaint? As I told you, very few people come to a doctor for headache. They would have tried many things at home. Only when they fail in all attempts, they would come to you. So your approach should be basically clinically assess first, and the next immediate thing you need to identify if there are any red flags for referral. That means there is something which a general practitioner cannot manage. So first you need to identify such condition and refer if required. But if you think there is nothing very serious, investigate and identify which type of headache is it. Basically, headaches are of two types, as you can see in the picture: primary headaches and secondary headaches. Secondary headaches usually follow certain infections in the body, maybe other conditions like hypertension, neuralgias, and some daily persistent headaches because of other pressures. What we will be talking today mostly is on the primary headaches, which are categorically three or four varieties. First comes the migraine, which occupies about 50 to 60% of headaches in India. Followed by tension headaches. These are increasing day by day because of the type of work the younger generation is doing, and most of the productive age group people have some or the other tension, either tension at home or at workplace or of a commuting in the city. This is becoming more worse, where commuting is more headache than anything else. So we need to find out what are the primary headache causes and accordingly manage. Then we will also talk of three or four special categories of people where headache need to be viewed as differently, that is children, pregnant women, elderly, and an average professional adult particularly. Though many people would have tried to do something at the home, you need to empower not only the individual but the family which comes with him or her to do a better home management. Finally, your own medical therapy, we will come to that a little later, and a passing mention of what an expert would do if you refer a case and what is the public health approach in the country for managing headaches. So these are the what do you do in step one. Here you have to evaluate and diagnose basic questions like when did it start, how long has it been there, how often do you get such a headache. Then what are the triggers? When do they get the headache? Maybe by eating some foods or certain situation, tensions in the office, for school children not doing homework, or refractory eyes, etc. So you need to find what triggers the headache, and if there is any family history of headaches. Sometimes these headaches are familiar also. You know, you also need to check if there are any notable symptoms in between the headaches. Usually, you may have changes in the vision, sometimes general weakness, sometimes loss of consciousness. To understand the severity of the headache, one need to find out if they're missing the work because of the headache, or when they are working, the headache bothers them not to do effectively the work. In addition, you will also find out how these headaches are affecting their quality of life. For example, the time they spend with their friends, going into the public, or when they sleep. Do they sleep quickly or headache bothers them? Of course, physically you will ask the location of the headache because very often by location only we can get some inference. And what is the pain like? How long does it last? And what are things that make the pain feel better? You also relate it to the timing of the headache. As I told you, if they did not have overnight sleep, maybe early in the morning, if something is bothering about the office, it may be before going to the office or school. Then you also need, if there are any warning signs or what we call as aura before headache. Usually there will be visual disturbances or blind spots. Sometimes people express the bright lights as a nuisance value. Long-term headaches may also lead to decreased appetite, change in the behavior of the person, particularly with an individual particularly. And then what treatment they have tried already at home. You need to check all these and then go in for basic physical examination of looking at if there is any temperature, what is the blood pressure like, balancing problem, eye problem, nasal problem, rhinitis or sinusitis, common cold, mid-ear problems, and muscle weakness. If there are any red signs, that's an indication for referral. We'll come to that in the next slide. Secondary headaches, basically you look for sinusitis, refractory errors of the eyes, and any other infections. If the case does not need referral, you will classify to see whether it is tension headache or migraine headache. Then look into their age, gender, and other situations and plan your treatment. The treatment or the management depends upon the individual and the situations. First thing first, do the case need reference? We all need to be trained to identify red flags, and basically these are where the treatment, there are ominous symptoms. That means there are symptoms which are indicative of either meningitis, encephalitis, which probably at your level you may not be able to manage, or there are refractory to the routine treatment. They say they have already tried 2, 3 doctors, XYZ treatment was given, nothing has happened. Then you have to be careful and to find out if it needs referral. It may be as simple as referring for the refractive errors or looking at ENT problems for sinusitis. The basic treatment pathways, we'll come to that a little later. Now this one guidelines for primary care management of headache should be posted in each of the clinician's room. Here, we start looking at the red flags. You can see the first box, which is called as first is thunderclap onset. That means suddenly the headache starts. Either there is fever or meningeal signals, or what we call as meningisms. If there is papilloedema or acute glaucoma, and then if there is temporal arteritis, so these things may be difficult, and if the person is very elderly, this may warrant you to refer the case to the concerned specialist. If there are possible indications of secondary headaches, look into the different signs, find out the system affected, and treat the primary cause, then they take it out automatically. If after ruling out both of these, then you will look at the headache, primary headache, try to classify as migraine, wherein you look at the behavioral management, and in the tension type headache, you go in for relief of tension and medication. And in case of cluster headache, you need to manage by again medicines. There are similar charts for different issues. We'll not go into those details. Now, this comparison of the site of headache should be able to help you in localizing and arranging the management. If the whole head is aching and the area of the brain is gradually increasing or squeezing, intensity is very small pain, duration is only half an hour to 1 week, and it is usually accompanied by fear of light and sound. This is called as over voltage headache. That means the light is getting it and bothering them. So probably you need to reduce the intensity of the light. In case of migraine, basically you see the head aches only in the forehead, maybe one side of the forehead. There is a pulsating and increasing pain. Pain is often severe, usually lasts for a few hours to 2 3 days. There is some fear of light. The arterial hypertension is usually seen in the occipital region. It is as if somebody is pressing on the back of their head. Pain is usually severe. The entire period of increased pressure. Usually there is a noise in the ears, dizziness, nausea, and vision disturbance. If there is an ischemic stroke, which has become common nowadays, what we used to think of a condition of 60 plus, now we are seeing many of these cases around 30, 40 years also. So usually here, the headache is partial one side, depending upon the paresis which is likely to happen on the opposite side. It is acute and growing, severe pain, continuous pain, and there would be disorders of the movement. This reminds me of the case which we saw just last week. A 52 years old software executive wakes up the spouse in the midnight. He had slept with a headache, but wakes up in the midnight to go to the toilet with a complaint that he is unable to move his left extremities. Of course, he was shifted immediately for emergency managed and turned out to be an ischemic stroke. So see that people 30 to 40 years plus, if there is a one-sided headache, one has to be very careful before it develops into ischemic stroke. If there is a hypotension, usually the headaches in the center or what we call it the crown area. Here also the brain is pressing pain, usually very mild but constant. There could be associated dizziness, tinnitus, tinnitus, fatigue, and drowsiness. So basically, you have to find out the cases to be managed based what primary care physician can do or without even at home. Then what can you as a practitioner do? Basically, you need to investigate blood pressure, refraction of the vision, and if required, you may go in for a plain radiography. First line is the common drugs for the which is paracetamols and NSAIDs. You can simply treat. If it involves neurological condition, better refer it to the next level. Resistant headaches need to go to the tertiary level. If you look at headaches in adult population in India, which is the commonest, these are very common as I told you, and in my first slide had told you that on any given day there will be about 20 crore people in our country who have some or the other type of headache. And if you look at the different types of headache, most of the common primary headaches, earlier it used to be migraine. Now the tension types of headaches are overtaking because of the various professional and domestic headaches. Episodic headaches, which is because less than 15 days per month, is reported usually in the school and college going children and in the office goer where there is a discord between the supervisor and this functionary. And this affects about 70% of the headaches in the current days. The common reason is stress, some or the other stress. Migraines usually affects people around the age of 30 years. It starts in adolescence. Women are affected more than men. Women get 3 times more than men. Usually, the common symptoms of different types of headaches are constantly worrying nature and inability to control anxiety. In India, most primary headaches are triggered by use of alcohol, usually red wine, processed meats that contain nitrate, changes in sleep or lack of sleep, poor posture, skipped meals, most importantly, stress of any kind. The global burden of diseases, which was done in 2019, about 5 years ago, said the world has an annually about 1.1 billion. That means 11 crore, of which half of them have migraine, and around 15% has tension type of headaches, and around 5 million, around 5%, what is called an H15 plus headache. That means headache which lasts for more than 15 days, mild, continuous. In India also, the migraine is gradually increasing. We expect an annually about 213 million people in India have migraine. In 29, in 19, today the number has gone up to almost 300 million. That is 3 crores. Among these cases, majority of them are in women, maybe 60 to 70%. Now, basically, as a primary care physician, your challenges are most of these headaches are initially perceived as low severe, lack of standard treatment protocols, and ultimately it is between you and the client to try to find out what may be the cause and manage by trial and error. There is no single specific shot. Of course, we will always start with the symptomatic treatment by using either NSAIDs or other analgesics. This burden I have already gone through. One of the recent study expects that we have about 4 million headaches in last 2023, of which majority were migraines. In terms of the age group getting affected, 20% of the headaches in India are in the age group of 10 to 20 years. This is basically for the challenges in the schools and the child labor children. In the adolescent, that is 21 to 30, this is the college days, easygoing days, least number of headaches are there, around 6%. Nearly half of the headaches are seen in the working group, that is 31 to 40 years, which is the prime time of professional growth. There is a lot to achieve. So everybody is in competition, sometimes unhealthy competition also. So this is the period of what we used to call in working days a period of competition. हिंदी we used to say in हिंदी कसरत करने के मेहनत यानी आप अपने आप को एस्टैब्लिश करने के लिए क्या कुछ करते रहते हैं, and that's the time when headache is highest proportion. Next comes the next age group of after relatively established time until retirement, which is around 20%, and the elderly people, the remaining 4 to 5%. Usually, the common risk factor identified by this particular evaluation is stress, traveling, bright light facing, loud sounds, and going through rigorous physical activities which will aggravate headache. In most people, it accounts for functional disability. जो काम करना है, they can't do it. Migraine is usually affecting female population, as I have already told, and this study thought that the proportion of headaches in female is tenfold compared to men. Most of the patients complain of severe fatigue both during and after, but the fatigue after the migraine is very high. Usually, many people carry on their work though they have headache, but the activity increases the intensity of the headache, and sometimes the quality of the work done will not meet their own standards without the headache. The factors which trigger headaches are mood swings, and in turn the patients usually get irritated, anger, aggressive behavior, and shouting at the family members. There is another common type of headache which we call as cervicogenic headache, which is basically because of the cervical spine level problem. Nearly 15 to 25% of the secondary headaches are related to cervical spine. Here is pain is referred from the neck and pursued in one or more region in the head. So it always starts from neck, goes upwards. It is 4% of the total headaches are of this origin, that is coming up from the cervical spine region. There appears to be a direct connection between trigeminal nerve or the cranial nerve, and therefore a postural default is one of the key trigger for this type of addiction. When you sleep, if people sleep without proper posture, either high pillow or on the side, something like that, so upright position in the human results in cervical gravitational compression, and over time these forces result in degenerative changes causing pain on the motion restriction. A recent study has also found that the muscle strength in suboccipital muscles, which are hardly exercised, is the reason. That is why nowadays one of the physical exercise you have to talk to your patients whether they are come for headache or not is to neck exercise, bending neck up and down, sidewards, etc. Headaches in children, basically here, as I told you, children they get hardly one quarter of the headache compared to adolescents. But this is age between 55 to 70 years, as I told you, basically because of these scholastic tensions or school performance tensions. Usually, the headache in children do not last for more than few hours, maximum of 72 hours. It may be accompanied with abdominal pain, vomiting, and nausea. These are usually related to disliking of a subject, disliking of a teacher, unable to do school homework, etc., etc. Some secondary headache causes among children are usually sinus infections, sore throat, ear infection, stress, anxiety, we already told. Very rarely, hemorrhage and tumor in the head. The red flags for the children is you need to look at the frequency, weakness or loss of sensation, headache on getting up in the morning, with or without vomiting, confusion or difficulty in thinking. These are warning signs in the children. Better refer them to pediatric specialist. In children, headaches often lead to visual disturbances or speech disturbances, and sometimes even their extremities movement. Some of the children lose their balance and probably the short memory loss, which is worst for the last 24 hours. They don't even remember what happened in the school, why did they fall down. But after a day or two, they can recall what exactly had happened. Most of these headaches in the children are not serious. Commonest being tension headaches and migraines, as I told you, basically because the tension in the school, keeping the child in cool place, putting a wet cloth on the forehead, rest in the dark room will resolve the problem. A paracetamol tablet may be required. Recurrent headaches, if they happen, it are all due to school problems, behavioral problems. Some child is being mistreated by friends or vice versa. So basic evaluation of the children remains the same as we did in adults. And coming to a conclusion, first, keeping the child calm and cool in a dark room, let them rest, and then if required, give some paracetamol. NSAIDs are not allocated for children. This is again a summary of common childhood headaches, migraine, tension headaches. Sometimes they get acute headaches basically because of some throbbing pain in the head, neck, or face. Acute recurrent headaches need to be addressed separately. Basic management in children involves medications, as I told you. If paracetamol does not help, NSAID like Brufen should be given in small dose, 200 milligrams for a child of 10 to 12 years plus. If it is under 5, better avoid Brufen. Headache education, basically looking for lack of sleep. If there are any specific foods or drinks, lots of chocolates, etc., one need to observe if they are related to it. And lifestyle changes, the number of sleeping hours for according to the age need to be maintained, and minimizing dehydration but adequate water consumption. The drinking of water among the school girls is becoming a problem. For want of toilet facilities, most girls minimize water drinking so that they are not forced to. And I'm also told in some of the schools, they don't allow the children to go to use the loo except during the interval. So in such cases, the children do not take enough air. That might result in headaches. So you need to work out on this. Recently, in one of the city in Karnataka, we had to work with the school teachers to say that there are a few children who need to be exempted even during class hour if they need to go. So stress management, basically taking a breathing exercise and then giving them some sports or music therapy. For secondary headaches in children, consultation with ophthalmologists, ENT people, and psychologists may be required. So this is how the diagrammatic representation, how stress can lead to the headache. Next, we look at the headache in the elderly. Here, as we grow older, headaches start reducing. After the age of 75, the headache drops by 55% in women and 21% in men. That means men suffer much less. The most common cause of headache among the elderly is cerebrovascular diseases, usually hypertension, head trauma, because as you know, as the adults lose balance, they fall down, and then the mild injuries may give them headache. Temporal arthritis is another common type, trigeminal neuralgia, and post-herpetic neuralgia. That is, they have herpes and then they get the headaches, which will last for long. It may last even for more than 3 months. Then there is what is called as the hypnic headaches, which is affecting about 70 to 40 to 80 years people. It's ruling out drug withdrawal. Sometimes a particular drug which they are used, if you withdraw, they may get headache. The next special group is the pregnant women. Pregnant women basically suffer headaches in the first trimester. The hormonal changes during this period, being the transition, affects the blood circulation and they have headache. The common causes which give is giving up caffeine, general fatigue, sinus congestion, pregnancy-induced hypertension, stress, hunger, and too much of exposure to sun or dehydration. And the management there is usually start with simple treatment with paracetamol. Usually we do not recommend aspirin and ibuprofen for the pregnant women. Cold compressions over the forehead and eyes and nose will help. Steam inhalation is highly beneficial. Either plain steam or adding with some eucalyptus oil or Vicks, something of that is very great use. Avoiding heat, now that the summer is coming, be careful if they need to avoid the heat. A mild massage over the back and shoulder is another easy way of helping pregnant women. Eating small meals, staying active, getting the eyes tested, and taking a cold shower help. Alternately, meditations, yoga, pranayama should be advised for, for all the pregnant mothers. Now, one of the studies done recently in the All India Institute indicate that India has in a year about 211 million migraine cases, nearly 300 million tension type headaches. As I told you, globally migraine outperforms tension type, but in India we are the reverse, and about 2.5 crore people have even what is called the chronic daily headache for at least 15 days per month. There are multiple studies showing the similar information both in West Bengal and Karnataka. Now, looking at the migraine, basically it is one-sided as the picture shows, and it has 4 stages. In the first stage, usually it starts with symptoms before actual pain. It is usually half side of the head, characterized by sensitivity to light and sound, mild depression, irritability, and lack of appetite. In the next stage, which is called as aura, nearly 20% of the migraine people have this type of what is called as visual perceptions, which include flashing of lights, geometric patterns, obscure vision, and temporary loss of half side of the vision. In the third stage, where the head pain increases, it could be moderate or severe, usually lasts for about 3 days. The intolerance to light, noise, and continues, there would be nausea and vomiting. Once it relieved, what is called as a post drain, usually lasts for quite a few days, and what we call as migraine hangover. It may be difficulty in concentrating and mood changes. The scalp may feel a little tender. In tension type headaches, you can always relate to some type of tension. You need to get more details, try to address the reason for the tension. Of course, you will always start with transient treatment, symptomatic NSAIDs or ibuprofen. Cluster headache is a difficult one, which is a sharp type of extremely painful headache, tends to occur in several times per day for months and suddenly disappears. These are 10% of these are chronic clusters, that means they continue for months and months together. The other common thing is what is called as a hormonal or menstrual migraine among women because of the hormonal maladjustment. usually among the oral contraceptive users, may experience such thing more often. Now, having seen this, we, as an academician, we look at certain theoretical considerations which basically takes care of the probability, prevalence, burden in the entire country, etc., and a figurative representation of the types of headache, migraine. If the sinus is there, you can see the headache is over the midline, frontal, and you press here, you will see the tenderness. And in the schoolboys, rubbing his nose and eyes with eyeglasses pulled up is an indication. The different locations of the headaches are shown here. Tension headache is usually central at the front. Temporal headaches, migraine is one-sided. Cluster headache is usually around an eye. Allergic headache is around upside of the nose, both sides, and occipital headache. If you use using phones in the dark, you are more likely to get occipital headache. So we have already dealt with different types of headache. I would not like to repeat them. The basic challenges in providing services is, from the larger public health perspective, there is no justification based assessment of the population about the burden of the disease. Absence of specialized services to deal with headache disorders continues to be there, because what a general practitioners cannot solve, probably general specialists will also be not be able to solve. For example, anything to do with ENT or sinus, eyes, etc. So if there is no local specialist or a psychiatrist, it may be difficult to solve. The neurologist perceptions usually are difficult. They look more on the psychological aspect than the neurological aspects. So in summary, I want to conclude by saying, you as a general practitioner are the people who see a lot of these cases. Most of headaches can be managed by you, but before you start indulging in managing, see that if there is an indication to refer, either by some emergency signs and symptoms, or the person having gone and tried some 2-3 general practitioners already, then you try to distinguish between the primary and secondary. Start with introducing some pain relievers, slowly talking to the patients and the attendants, find out the reasons and address the reasons. Thank you. Faraz, over to you. Faraz, it is over to you. Hello?
So much, sir, for giving your valuable time and sharing your knowledge with us and making this session informative one. I definitely think this session knowledge is going to help all the participants during this practice. Sir, we have received some questions, sir. If you allow, with all your permission, shall we take these
Please
questions?
go ahead if there are any questions.
Yeah, the first question is, for what is the role of lifestyle in managing headache?
What is the role of?
Role of lifestyle.
Lifestyle. Okay. The key three important things. There are many. Three most important thing is minimum required number of sound sleep per day. That is the first. According to the age, if it is an adult, a 7 to 8 hours of sound sleep is the first criteria. Make whatever is required to get that sleep. Second, minimize either overeating or long hours of fasting. Third, avoid dehydration by adequate fluid intake and, though not strictly lifestyle, learn to manage addressing the stress. You cannot say that I will not have stress, but we need to learn to handle the stress so that it does not disturb our routine.
Okay, sir. Thank you so much, sir, for sharing some important times on managing headache. Sir, another question is, sir, what strategies can be employed to manage patient expectation regarding the outcome of headache treatments?
Please repeat, please repeat.
I'll tell you the once
You have
again
to
the
be little
question.
louder, Faraz. I am not hearing. You have to be little
Yes.
louder.
Yes, sir. The question is, sir, what strategies can be employed to manage patient expectation regarding the outcome of treatments?
What treatment?
Sir,
Outcome,
the question.
okay. Outcome of
Yes, sir.
treatment is basically the first thing is if you give them a pain reliever, in the next half an hour, do not talk to them. Get them some pain reliever, make them sit in your clinic. Once the pain goes down, try to talk to them to identify the cause and help them in addressing that particular cause. As I told you, today in the Indian circumstances, men have headache mainly due to stresses, optional, both professional stress and familiar stress. Women have problem because of the migraine. So according to the condition, you need to strategize the treatment over a long period and try to slowly modify their lifestyle, because most often we see in 70 to 80% of the cases, usually their lifestyle of daily routines are not disciplined.
Thank you so much, sir, for answering this question. As I can see, sir, there is no more question from the participant. As there is no more question, sir, with all your permission, shall we conclude this session for today?
Thank you. Thanks to
Thank you so
all
much.
friends who have joined the group and you for us.
Welcome, sir. Sir, take care, sir. Hope to see you again with different topic also in future, sir. Till then, take care of
Okay,
yourself.
most
Have a
welcome.
great day.
Most welcome.
Bye,
Thank you. I
sir.
am quitting.
Yeah, yeah, sir.